I need to ask you about performing an autopsy on Bill.
Come in.
Hi, Ms. James.
Yes.
Hi, my name is Dr. Kamek. I'm the physician resident on duty tonight. It's nice to meet you.
Yes.
Sorry. It's nice to
My
meet
daughter,
you.
Sam.
Nice to meet you.
I'm so sorry to hear about Bill's death.
Thanks.
Please accept my condolences for your loss of your husband and your father. I know that this is a really difficult time for you both.
Yes, it's been a bit of a shock. We knew Bill hadn't been doing well with the cancer, but I never thought he would die so suddenly.
This was not something that we anticipated happening so soon. Do either of you have any questions for me regarding Bill's death?
I don't think so, no.
No.
Ms. James, I know that you've been talking to a lot of people today about Bill's death, and I know that you probably just want to spend some alone time with your daughter. But if it's okay with you, I have one last important thing I'd like to discuss with you.
Sure, what's that?
So I need to ask you about performing an autopsy on Bill.
An autopsy?
Yeah, so this is something that we ask permission for with all the patients who die at the hospital.
I don't understand. We know what Dad died from. It was the cancer. It was nothing suspicious. Why would you need to perform an autopsy?
That's true, Sam. I mean, the cancer is a deadly disease and is most likely what caused your father's death. But because it happened so soon, there could be some other disease that had something to do with his death. And an autopsy could give us the information that could help us better understand why this happened. The results of the autopsy could also help us improve treatments for future patients like your father. They're actually really quite important to the medical community. They help with the education of future physicians. But more importantly, it can help give some closure to you.
I don't know. I don't like to think of Bill's body being cut up and mutilated. And we were planning to have an open casket funeral, so I'm not sure that would work.
I totally understand, and I respect your wishes. But if I may, could I explain the process of an autopsy to you so that you can better understand what would happen to Bill's body? It's likely not what you have in mind.
Sure, go ahead.
So an autopsy is performed by a pathologist who's going to examine the inside and the outside of Bill's body. In a procedure very similar to a surgery, an incision will be made from the chest to the abdomen so they can examine inside. They'll carefully remove Bill's organs so that they can closely examine them for any signs of disease. The doctor's also going to take small tissue samples of the organs so that they can later examine those with a microscope. Now, unless you decline, Bill's brain would also be removed and closely examined for any signs of disease. After the exam is complete, all of the incisions would be closed up with sutures. Bill's body would be cleaned and transferred to the funeral home. There will be no disturbance to his face or any parts of his body not already covered by clothing. So your wishes for an open casket funeral will not be affected by this at all.
How soon would an autopsy happen?
Yeah, so right away, within 24 hours. Now, the results of the exam could take between 1 and 2 months, depending on how many tissue samples they take. And the results will be sent to Bill's physician, and he will go through those with you and answer any questions that you may have. And also the pathologist who performed the autopsy will also be available to answer any of your questions.
I don't know. We've had a lot of medical expenses lately, and now we're going to have the expenses of the funeral. I'm not sure I can afford much more right now.
So there'll be no cost to you to perform the autopsy, and we'll also make sure this doesn't interfere at all with your funeral arrangements.
I'm sorry, Dr. Kamek. This is a lot to process. I just don't think we can answer this right now.
Yeah, I totally understand, and I appreciate how you must be feeling. If you're going to be here for a little while, would it be okay if I stopped back in to see if you had any other questions about what we've discussed?
Sure, why don't you do that?
Okay, so if you have any other questions before I return, just have the charge nurse page me.
Okay.
Okay? All right.
Thank you.
Thank you. Hi.
Hi.
So did either of you have any questions about the autopsy process that have come up since we spoke last?
Sam, I think you had a question.
I still don't understand why the hospital wants to perform an autopsy since we know how Dad died.
Sam, that's a great question and one that most families ask. So we're a teaching hospital, and autopsies are one important way that we can learn more about our patients. In the case of your father, he was undergoing cancer treatment, but there could have been some other condition that led to his death. By taking a closer look, we can better understand why this happened and perhaps improve treatment options for future cancer patients.
So this might be helpful down the road for other patients and their families.
Yes, absolutely. We have learned a great deal by being able to perform autopsies and are so thankful for those who allow us to perform them.
Well, if it could be helpful for other families, I guess I'm okay with it. What do you think?
Okay.
Well, thank you for allowing this. Just take solace in the fact that Bill's autopsy really could help people in the future. I'll take care of all of the arrangements, and all I need from you, Miss James, is a signature on this consent form that says that you've given us permission to perform the autopsy on Bill.
Do you have a pen? Here you go.
Thank you. Do either of you have any other questions?
No, I think we're all set for now. Thank you very much for coming by and explaining this process. I hope this will be helpful.
Thank you so much for spending the time with me.
Yes, thank everyone for all of the wonderful things that they've done for Dad throughout his cancer treatments. We really appreciate it.
From what I've heard, Bill was very well liked by everybody here. And again, my condolences to you for your loss. And if you have any other questions, don't hesitate to ask us. We're here to help you through this.
Thank you. Thank you very much.
Thank you so much.
Thank you.